Question 1. EEG recording and interpretation. During an EEG recording, a patient exhibits generalized rhythmic delta activity over both hemispheres that persists throughout wakefulness. The activity does not change significantly with eye opening or closing and is not influenced by external stimuli. The technician suspects that this pattern may indicate an underlying pathological condition. Which of the following conditions is the most likely explanation? This EEG finding: A. Normal variant in a drowsy adult, B. Absence seizure disorder, C. Metabolic encephalopathy, D. Benign Rolandic epilepsy. Answer: C. Metabolic encephalopathy. Explanation: generalized rhythmic delta activity that persists in wakefulness without modulation by external stimuli is a strong indicator of diffuse cerebral dysfunction. This pattern is commonly associated with metabolic encephalopathy, which can result from liver failure, uremia, or toxic exposure. According to the American Clinical Neurophysiology Society (ACNS) guidelines, persistent delta slur over both hemispheres typically suggests a diffuse cerebral disturbance rather than afocal or localized epilepsy disorder. Option A is incorrect because normal drowsiness can include intermittent delta activity, but it would not persist throughout wakefulness. Option B is incorrect because absence seizures typically show generalized 3/8C spike and wave discharges, not continuous rhythmic delta activity. Option D is incorrect because benign Rolandic epilepsy is characterized by centrotemporal spikes, not generalized rhythmic delta slowing. Thus, metabolic encephalopathy is the most likely cause of this EEG pattern, requiring further medical evaluation for underlying systemic disorders. Question 2. Scenario-based. Patient preparation and safety MS. Ramirez, a 58-year-old patient with a history of diabetes and hypertension, is scheduled for an EEG to evaluate intermittent confusion and possible seizure activity. When preparing for the procedure, the Neurodiagnostic Technologist notices that the patient has multiple skin lesions on her scalp due to a recent outbreak of shingles. Given this condition, what is the course of action for the Technologist? A. Proceed with electrode placement as usual, but ensure proper skin preparation to reduce impedance. B. Apply electrodes to unaffected areas only and continue the EEG as planned. C. Postpone the EEG and consult with the referring physician for guidance on whether an alternative method, such as a limited lead placement or another diagnostic test, should be considered. D. Use needle electrodes instead of surface electrodes to bypass the affected skin. Answer C. Postpone the EEG and consult with the referring physician for guidance on whether an alternative method, such as a limited lead placement or another diagnostic test, should be considered. Explanation: shingles, herpes zoster, is an infectious condition that can cause painful, open lesions on the scalp. Applying EEG electrodes over affected skin poses several risks, including increased discomfort and pain for the patient, risk of infection spread, worsening of lesions due to pressure from electrodes, poor signal quality due to skin breakdown, which may cause excessive impedance and artifact interference. According to infection control guidelines and best practices in neurodiagnostics, EEG procedures should not be conducted on areas with open lesions, burns, or severe skin irritation unless absolutely necessary. The safest approach is to consult with the referring physician to determine what alternative test, such as video EEG monitoring, a reduced lead EEG setup, or a different imaging study, would be appropriate. Option A is incorrect because proceeding with standard electrode placement could cause pain and skin damage. Option B is incorrect because avoiding the lesions may still result in incomplete data and compromised accuracy of the recording. Option D is incorrect because needle electrodes pose an even greater risk of skin infection and pain. Thus, consulting with the physician to reassess the testing approach is the most appropriate action. Question 3. Neurodiagnostic instrumentation and technology. Evoke potentials. Beeps during brainstem auditory evoke potential. Beep study. The Technologist notices delayed latency of wave V, with waves I enrollment to appearing normal. This pattern is most commonly associated with which of the following conditions? A. Acoustic neuroma, vestibular schwannoma. B. Conductive hearing loss. C. Multiple sclerosis. D. Brainstem stroke affecting the medulla. Answer A. Acoustic neuroma, vestibular schwannoma. Explanation: the beep test measures electrical responses from the auditory nerve and brainstem pathways in response to auditory stimuli. A selective delay in wave V latency with normal wave I roamed through latencies suggests a lesion affecting the superior brainstem auditory pathways, often seen in acoustic neuroma vestibular schwannoma. Option B is incorrect because conductive hearing loss affects wave I, not wave V, as the cochlea and auditory nerve receive reduced stimulation. Option C is incorrect because multiple sclerosis typically results in scattered demyelination, which may cause broader delays across multiple beat waves rather than an isolated wave V delay. Option D is incorrect because brainstem strokes in the medulla typically do not affect the auditory pathways at the level necessary to produce isolated wave V delay. According to clinical neurophysiology guidelines, acoustic neuromas commonly affect the cerebellopontine angle, where they compress the cochlear nerve and disrupt conduction to the brainstem, leading to this characteristic beep abnormality. Thus, the most likely cause of an isolated wave delay is an acoustic neuroma, requiring further investigation through imaging and clinical correlation. Question 4. Topic: EEG recording and interpretation. During a routine EEG recording, a 45-year-old patient presents with rhythmic sharp waves occurring in the temporal region, which increase in frequency during drowsiness. The technologist also observes that these discharges become more prominent with hyperventilation but are not eliminated by eye opening. The patient's clinical history includes episodes of loss of awareness, unresponsiveness for 3.060 seconds, sometimes with automatisms such as lip smacking and hand fumbling. Based on these findings, what is the most likely underlying condition, and how should the technologist classify these EEG discharges? A. Benign epileptiform transients of sleep (BETS). B. Temporal lobe epilepsy with mesial temporal sclerosis. C. Generalized absent seizures. D. Wicked spikes, a normal EEG variant. Answer: B. Temporal lobe epilepsy with mesial temporal sclerosis. Explanation: the rhythmic sharp waves in the temporal region, especially those increasing in frequency with drowsiness and hyperventilation, are highly suggestive of temporal lobe epilepsy (TLE), particularly with mesial temporal sclerosis. The patient's clinical history of brief episodes of unresponsiveness and automatisms further supports this diagnosis. Why B is correct. Lobe epilepsy often shows epileptiform discharges in the anterior temporal regions, and it is exacerbated by drowsiness. YA is incorrect. BET's benign epileptiform transients of sleep are usually low-voltage, short-duration sharp waves that do not correlate with clinical seizures. YC is incorrect. Generalized absent seizures typically show 3HC spike and wave discharges, not temporal sharp waves. YD is incorrect. Wicked spikes are a benign EEG variant often found in the mid-temporal region but are not associated with seizures. Question 5. Topic: Intraoperative neurophysiological monitoring, IONM, and safety considerations. A neurodiagnostic technologist is monitoring a spinal surgery using somatosensory evoked potentials (SEP) and motor evoked potentials (MEP). During the procedure, there is a sudden and significant drop in amplitude of the SEP waveforms in the lower extremities, with no change in the upper extremities. The MEPs also show a decreased response, particularly on one side. The surgeon is alerted immediately. Based on the findings, what is the most appropriate course of action? A. Continue monitoring, as this is a normal response to anesthesia. B. Suggest repositioning the patient and checking for mechanical compression of the spinal cord. C. Ignore the changes unless the patient shows clinical symptoms postoperatively. D. Increase the gain on the amplifier to enhance waveform visibility. Answer: B. Suggest repositioning the patient and checking for mechanical compression of the spinal cord. Explanation: intraoperative monitoring aims to detect neurological compromise before it becomes permanent. The sudden loss of SEP amplitude in unilateral MEP depression suggests spinal cord ischemia or mechanical compression. Why B is correct. The immediate response should be to alert the surgeon and check for potential causes such as VAP, compromise, excessive retraction, or patient positioning issues. YA is incorrect. While anesthesia can attenuate waveforms, it does not cause sudden unilateral changes. YC is incorrect. Ignoring these changes could result in postoperative paralysis or neurological deficits. YD is incorrect. Adjusting gain does not fix the underlying physiological issue. Question 6. Topic: Neurodiagnostic instrumentation. Electrode placement and montages. Hospital is transitioning from using the 1.0/2.0 system to the 1.0/1.0 system for electrode placement to enhance spatial resolution in EEG recordings. Neurodiagnostic technologist is responsible for training new staff on the differences between these two systems. Which of the following statements best explains the distinction between these electrode placement systems? A. The 1 2 system places electrodes in 5% increment, while the 1 system places them in 20% increments. B. The 1 system adds additional electrodes between standard 2 locations, increasing spatial resolution. C. The 1 system is used only for pediatric patients, while the 1 system is only for adults. D. Both systems place electrodes at identical locations with no difference in spatial resolution. Answer: B. The 1 system adds additional electrodes between standard 2 locations, increasing spatial resolution. Explanation: the 1 system is an extension of the 2 system, adding more electrodes for higher spatial resolution and better localization of epileptiform activity. Why? B is correct. The 1 system increases the number of placing additional electrodes halfway between standard 2 sites, enhancing precision. YA is incorrect. The 1 system places electrodes in 10% and 20% increments, while the 1 system uses 10% increments. YC is incorrect. Both systems can be used for both adults and pediatric patients. YD is incorrect. The 1 system greater spatial resolution, making it different from the 2 system. Question 7, scenario-based. Topic: polysomnography and sleep disorders. Mr. Martinez, 60-year-old male, is referred for sleep study due to excessive daytime sleepiness, loud snoring, and witnessed apneas. During his polysomnography (PSG), the technologist observes frequent apneas lasting more than 10 seconds with significant oxygen desaturation below 85%. The apneas appear to be associated with complete cessation of airflow despite continued respiratory effort. Based on these PSG findings, what is the most likely diagnosis? A. Central sleep apnea, CSA. B. Obstructive sleep apnea, OSA. C. Periodic limb movement disorder, PND. D. Narcolepsy. Answer: B. Obstructive sleep apnea, OSA. Explanation: the findings indicate obstructive sleep apnea, OSA, characterized by repetitive apneas with continued respiratory effort due to upper airway collapse. Why? B is correct. OSA is diagnosed when there are 5 or more obstructive respiratory events per hour on PSG, with oxygen desaturation and loud snoring. YA is incorrect. CSA involves cessation of both airflow and respiratory effort, which was not observed in this case. YC is incorrect. PMD involves repetitive leg movements during sleep but does not cause apneas or oxygen desaturation. YD is incorrect. Narcolepsy presents with excessive daytime sleepiness and sleep onset REM periods, but not obstructive apneas. Question 8. Topic: EEG patterns in epilepsy. A 12-year-old girl is referred for an EEG after experiencing multiple episodes of staring spells at school. During the recording, the EEG shows generalized 3Hc spike and wave discharges, especially during hyperventilation. The child's episodes last 1015 seconds, during which she appears unresponsive but resumes activity without confusion. What is the most likely diagnosis, and which EEG characteristic is most specific for this condition? A. Juvenile myoclonic epilepsy. JME EEG shows polyspike wave discharges. B. Benign Rolandic epilepsy. EEG shows centrotemporal spikes. C. Absence epilepsy. EEG shows 3Hc spike and wave discharges. D. Temporal lobe epilepsy. EEG shows temporal sharp waves. Answer: C. Absence epilepsy. EEG shows 3Hc spike and wave discharges. Explanation: the child's brief episodes of staring with no post-ictal confusion and EEG showing generalized 3Hc spike and wave discharges during hyperventilation are classic for absence epilepsy. YC is correct. Absence epilepsy presents with sudden onset and resolution of staring episodes, and the EEG hallmark is generalized 3H spike and wave discharges. YA is incorrect. GME typically presents with myoclonic jerks and polyspike wave discharges, not 3Hc activity. YB is incorrect. Benign Rolandic epilepsy features centrotemporal spikes, usually during sleep. YD is incorrect. Temporal lobe epilepsy involves focal temporal sharp waves and typically causes longer-lasting focal seizures. Question 9. Topic: evoked potentials. In multiple sclerosis, a patient with a history of numbness and tingling in both legs undergoes somatosensory evoked potential (ESEP) testing. The results show prolonged central conduction time in the posterior tibial nerve pathway with normal peripheral conduction. MRI findings show multiple demyelinating plaques in the brain and spinal cord. Which condition is most likely, and how do the SEP findings correlate with the disease? A. Multiple sclerosis MS, the delayed central conduction due to demyelination. B. Guillain-Barré syndrome, slowed conduction due to peripheral demyelination. C. Amyotrophic lateral sclerosis ALS, and normal SEP findings but abnormal motor evoked potentials. D. Myasthenia gravis, fluctuating conduction velocities on SEP. Answer A. Multiple sclerosis MS, a delayed central conduction due to demyelination. Explanation: the prolonged central conduction time with normal peripheral conduction is characteristic of demyelination in the central nervous system seen in multiple sclerosis MS. YA is correct. MS causes demyelination in the CNS, leading to delayed conduction in SEPs. YB is incorrect. Guillain-Barré syndrome affects peripheral nerves. Central conduction. YC is incorrect. ALS affects motor neurons, so SEPs are often normal. YD is incorrect. Myasthenia gravis affects the neuromuscular junction, not SEP pathways. Question 10. Topic: Artifacts in EEG. A 55-year-old man undergoing EEG recording exhibits rhythmic 60 Hz activity that is consistent across all channels, most prominent in the frontal region. The technologist notices that the patient is lying close to an electrical outlet. What is the most likely cause of this artifact, and what should the technologist do to eliminate it? A. EEG artifact. Ask the patient to relax facial muscles. B. Electrode popping. Replaced effective electrodes. C. 60 Hz electrical interference. Adjust the ground electrode and relocate the patient. D. Pulse artifact. Adjust the electrode over the radial artery. Answer: C. 60 Hz electrical interference. Adjust the ground electrode and relocate the patient. Explanation: why C is correct. 60 Hz interference is caused by electrical sources such as outlets, fluorescent lights, or improper grounding. YA is incorrect. EEG artifact is muscle-related, not a steady 60 Hz rhythm. YB is incorrect. Electrode popping appears as intermittent sharp transients, not continuity. YD is incorrect. Pulse artifact is synchronized with the heartbeat and does not present as continuous 60 Hz activity. Question 11. Topic: Brainstem auditory evoked potentials. B. Patient suspected of having acoustic neuroma, vestibular schwannoma, undergoes brainstem auditory evoked potentials beep testing. The test results show significant prolongation of wave V latency and an interpeak latency delay between waves I and V in the affected ear. What do these findings indicate? A. Demyelination of the auditory pathway due to multiple sclerosis. B. Brainstem stroke affecting auditory pathways bilaterally. C. Acoustic neuroma causing compression of the auditory nerve. D. Normal beep findings with hearing loss due to otosclerosis. Answer: C. Acoustic neuroma causing compression of the auditory nerve. Explanation: beep abnormalities in acoustic neuroma typically show delayed wave V and prolonged IV interpeak latency due to compression of the auditory nerve and brainstem structures. Question 12. Topic: EEG findings in status epilepticus. A 45-year-old man with a history of epilepsy is brought to the emergency department after having continuous seizures for over 30 minutes despite initial treatment with benzodiazepines. An EEG is performed and shows continuous generalized spike and wave discharges with no return to baseline activity between discharges. What is the most likely diagnosis and what is the appropriate next step? Absence epilepsy. Start ethosuximide. B. Generalized convulsive status epilepticus. Administer antiepileptic drugs. C. Temporal lobe epilepsy. Perform MRI of the brain. D. Psychogenic non-epileptic seizures. Discontinue treatment. Answer: B. Generalized convulsive status epilepticus. Administer antiepileptic drugs. Explanation: why B is correct. Continuous generalized spike and wave discharges without recovery between seizures indicate status epilepticus, which is a medical emergency requiring aggressive treatment with anti-seizure medications, e.g. phenytoin, levetiracetam, or phenobarbital. YA is incorrect. Absence epilepsy typically brief episodes 1015 sec with 3 He spike and wave, not prolonged seizures. YC is incorrect. Temporal lobe epilepsy often presents with focal discharges and does not typically cause generalized status epilepticus. YD is incorrect. Psychogenic non-epileptic seizures lack EEG abnormalities during episodes. Question 13. Topic: Visual evoked potentials in optic neuritis. A 30-year-old woman presents with sudden onset blurry vision in her right eye and pain with eye movement. Neurological examination reveals a relative afferent pupillary defect wrapped in the affected eye. Visual evoked potentials VEPs show a prolonged P latency in the right eye. Which condition is most likely, and how do the VEP findings correlate? 8. Multiple sclerosis, a delayed conduction due to optic nerve demyelination. B. Glaucoma, a VEP shows reduced amplitude without latency delay. C. Macular degeneration, normal VEP but abnormal fundoscopic exam. D. Migraine or a normal VEP with transient visual symptoms. Answer A. Multiple sclerosis, a delayed conduction due to optic nerve demyelination. Explanation: why A is correct. Prolonged P latency is a hallmark of optic nerve demyelination, which is strongly associated with multiple sclerosis. MS. Why B is incorrect. Glaucoma affects retinal ganglion cells, leading to amplitude reduction, not latency delay. Why C is incorrect. Macular degeneration affects the central retina but spares optic nerve, so VEPs are often normal. Why D is incorrect. Migraine auras cause transient visual symptoms, but VEP findings are typically normal. Question 14. Topic: features of Creutzfeldt-Jakob disease. A 60-year-old man presents with rapidly progressive dementia myoclonus and ataxia over a period of 3 months. Shows periodic sharp wave comp-swabber occurring every 1-2 seconds. What is the most likely diagnosis, and what additional tests can confirm it? A. Creutzfeldt-Jakob disease EAE 3 protein analysis. B. Alzheimer's disease, the MRI showing hippocampal atrophy. C. Frontotemporal dementia, each showing frontal slowing. D. Lewy body dementia, each showing diffuse slowing without sharp waves. Answer A. Creutzfeldt-Jakob disease EAE 3 protein analysis. Explanation: why A is correct. Creutzfeldt-Jakob disease (CJD) causes rapid neurodegeneration and is associated with periodic sharp wave complexes on EEG. The CSF143 protein test supports the diagnosis. Why B is incorrect. Alzheimer's disease progresses slowly and shows generalized slowing, not periodic sharp waves. Why C is incorrect. Frontotemporal dementia mainly causes behavioral and language issues, not EEG abnormalities. Why D is incorrect. Lewy body dementia presents with diffuse EEG slowing, not periodic complexes. Question 15. Topic: EEG findings in hepatic encephalopathy. A 50-year-old man with cirrhosis and altered mental status undergoes EEG, which shows bilateral, synchronous, high-amplitude triphasic waves predominantly in the frontal regions. What is the most likely cause of this EEG pattern? A. Toxic metabolic encephalopathy. B. Focal epilepsy. C. Normal EEG variant. D. Brainstem stroke. Answer A. Toxic metabolic encephalopathy. Explanation: triphasic waves are strongly associated with hepatic encephalopathy and other metabolic disorders affecting the brain. Question 16. Topic: nerve conduction studies in Guillain-Barré syndrome. 40-year-old man presents with progressive ascending weakness over the last 7 days. Nerve conduction studies NCS show prolonged F wave latencies, conduction block, and slowed conduction velocities. What is the most likely diagnosis? A. Guillain-Barré syndrome (GBS). B. Amyotrophic lateral sclerosis (ALS). C. Multiple sclerosis (MS). D. Myasthenia gravis (A). Answer A. Guillain-Barré syndrome (GBS). Explanation: GBS is an acute inflammatory demyelinating polyneuropathy that causes slowed conduction velocities and prolonged F-wave latencies due to peripheral nerve demyelination. Question 17. Topic: EEG brain death. A 65-year-old man is admitted to the ICU following a severe traumatic brain injury. Despite maximal medical management, he remains unresponsive with no brainstem reflexes. A confirmatory EEG is performed and shows a flat isoelectric tracing with no reactivity to external stimuli. What is the most likely interpretation of this EEG, and what additional tests may be required? Confirmation: A. Brain death. Confirmatory tests include cerebral angiography or transcranial Doppler. B. Coma. EEG will improve with time. C. Non-convulsive status epilepticus, a repeat EEG with higher sensitivity. D. Locked-in syndrome. Patient is conscious but unable to move. Answer A. Brain death. The confirmatory tests include cerebral angiography or transcranial Doppler. Explanation: why A is correct. A flat isoelectric EEG without reactivity suggests brain death, which must be confirmed with clinical criteria and additional tests like cerebral angiography, transcranial Doppler, or nuclear perfusion scans. Why B is incorrect. Coma patients typically show diffuse slowing, not complete EEG suppression. Why is incorrect. Non-convulsive status epilepticus often presents with spike and wave activity, not a flat EEG. Why D is incorrect. Locked-in syndrome patients retain cognitive function and EEG activity remains normal. Question 18, topic somatosensory evoked potentials in spinal cord injury. A 28-year-old man presents to the emergency department after a motorcycle accident. He has loss of motor function below that level and an absent SEP response when stimulating the tibial nerve at the ankle. However, SEPs from the median nerve remain intact. What is the most likely diagnosis? A. Complete spinal cord injury. B. Peripheral neuropathy. C. Cervical radiculopathy. D. Hemispheric stroke. Answer A. Complete spinal cord injury. Explanation. Why A is correct. The absence of tibial nerve SEPs with intact median nerve SEPs suggests a spinal cord lesion below the cervical level, like it. Why B is incorrect. Peripheral neuropathy would affect both upper and lower limb SEPs. Why C is incorrect. Cervical radiculopathy would cause arm weakness, but the tibial SEP should be normal. Why D is incorrect. Strokes affect cortical function, not spinal pathways. Question 19, topic EEG in absence epilepsy. A 9-year-old girl is brought to the clinic due to frequent staring episodes lasting 1015 seconds. During EEG recording, hyperventilation induces the generalized 3A-Z spike and wave discharge that stops when the episode ends. What is the best treatment for this condition? A. Ethosuximide. B. Phenytoin. C. Carbamazepine. D. Gabapentin. Answer A. Ethosuximide. Explanation. Why A is correct. Ethosuximide is the first-line treatment for absence epilepsy characterized by generalized 3AC spike and wave activity. Why B and C are incorrect. Phenytoin and carbamazepine can worsen absence seizures. Why D is incorrect. Gabapentin is not effective for absence epilepsy. Question 20, topic BEEP in multiple sclerosis. A 32-year-old woman with MS presents with dizziness and hearing loss. BEEP testing shows prolonged interpeak latencies between waves I and Rome's and the right side. What does this finding suggest? A. Demyelination affecting the auditory pathway. B. Peripheral vestibular dysfunction. C. Normal aging-related changes. D. Stroke in the auditory cortex. Answer A. Demyelination affecting the auditory pathway. Explanation. Why A is correct. MS causes demyelination, leading to delayed BEEP waveforms. Why B is incorrect. Peripheral vestibular dysfunction does not affect BEEP. Why C is incorrect. Normal aging does not cause focal delays. Why D is incorrect. A stroke in the auditory cortex does not affect brainstem wave latencies. Question 21, topic EEG in juvenile myoclonic epilepsy. A 16-year-old girl presents with morning myoclonic jerks and occasional generalized tonic-clonic seizures. She has no loss of consciousness during myoclonic jerks but reports that they are more frequent after waking up. An EEG shows bilateral polyspike and wave discharges at 4-6 Hz. What is the most likely diagnosis and what is the first-line treatment? A. Juvenile myoclonic epilepsy, JME valproate. B. Absence epilepsy, ethosuximide. C. Lennox-Gastaut syndrome, topiramate. D. Frontal lobe epilepsy, carbamazepine. Answer A. Juvenile myoclonic epilepsy, JME valproate. Explanation. Why A is correct. Juvenile myoclonic epilepsy, JME, is characterized by myoclonic jerks upon awakening, generalized polyspike and wave discharges, and a high response to valproate. Why B is incorrect. Absence epilepsy lacks myoclonic jerks and shows 3Z spike and wave activity. Why C is incorrect. Lennox-Gastaut presence earlier, so spike and wave 1.5, 2.5 Hz. Why D is incorrect. Carbamazepine may worsen JME seizures. Question 22, topic BEEP in multiple sclerosis. A 32-year-old woman presents with intermittent blurred vision in the right eye, numbness in both legs, and difficulty walking over the past several months. MRI reveals multiple periventricular white matter lesions. Brainstem auditory evoked potentials. BEEP show prolonged interpeak latencies between wave Rome and V bilaterally. What is the most likely explanation for these BEEP findings? A. Demyelination in the brainstem affecting auditory pathways. B. Primary cochlear dysfunction. C. Cortical stroke involving the auditory cortex. D. Peripheral vestibular dysfunction. Answer A. Demyelination in the brainstem affecting auditory pathways. Explanation. Why A is correct. Multiple sclerosis MS is a demyelinating disease that affects the brainstem and auditory pathways, leading to delayed BEEP latencies, particularly between wave Rome and V, which correspond to brainstem conduction. Why B is incorrect. Primary cochlear dysfunction would not affect BEEP interpeak latencies. Instead, it would affect wave amplitude. Why C is incorrect. A cortical stroke does not significantly affect BEEP since the response is generated in the brainstem. Why D is incorrect. Peripheral vestibular dysfunction does not cause prolonged interpeak latencies in beep. Question 23. Topic. Enginals, a 58-year-old man presents with progressive muscle weakness, difficulty swallowing, and slurred speech. Examination reveals muscle fasciculations, hyperreflexia, and muscle atrophy. Findings show fibrillation potentials positive, sharp waves, and chronic motor unit remodeling in multiple regions. What is the most likely diagnosis? A. Amyotrophic lateral sclerosis ALS, B. Guillain-Barré syndrome GBS, C. myasthenia gravis, and D. Lambert-Eaton syndrome less. Answer A. Amyotrophic lateral sclerosis ALS. Explanation: ALS is a neurodegenerative disease affecting upper and lower motor neurons. Findings include fibrillation potentials and positive sharp waves, active denervation, large polyphasic motor units, chronic denervation with reinnervation, findings in multiple regions supporting ALS diagnosis per Ellis-Goriel criteria. GBS-B is a demyelinating polyneuropathy with reduced conduction velocity, not active denervation. NG-C shows a decremental response on repetitive nerve stimulation, not denervation. LES-D shows incremental response, not chronic denervation. Question 24. Topic. EEG absence seizures. A 10-year-old boy presents with brief episodes of staring and unresponsiveness lasting 1015 seconds occurring multiple times per day. EEG shows 3AC generalized spike and wave discharges. What is the most likely diagnosis and first-line treatment? A. Absence epilepsy, ethosuximide. B. Focal epilepsy, carbamazepine. C. Juvenile myoclonic epilepsy, valproate. D. Frontal lobe epilepsy, levetiracetam. Answer A. Absence epilepsy, ethosuximide. Explanation: absence seizures are non-motor generalized seizures characterized by brief staring spells with 3AC spike and wave discharges. First-line treatment: ethosuximide, effective for absence epilepsy. Carbamazepine, B, may worsen absence seizures. Valproate, C, is used for juvenile myoclonic epilepsy, JME. Levetiracetam, D, is preferred for focal seizures, not absence seizures. Question 25. Topic. Mgen carpal tunnel syndrome. A 40-year-old woman presents with numbness, tingling, and pain in the first three fingers, especially at night. Nerve conduction studies NCS reveal prolonged median nerve distal latency and reduced conduction velocity at the wrist. What is the most likely diagnosis? A. Carpal tunnel syndrome. B. Ulnar neuropathy. C. Radial neuropathy. D. Cervical radiculopathy. Answer A. Carpal tunnel syndrome. Explanation: carpal tunnel syndrome (CTS) is caused by median nerve compression at the wrist. Electrodiagnostic criteria: prolonged distal latency of the median nerve, reduced conduction velocity across the wrist, normal conduction in the ulnar and radial nerves. While these are incorrect, ulnar neuropathy B affects the fourth and fifth digits. Radial neuropathy C causes wrist drop, not median. Symptoms: cervical radiculopathy D affects multiple nerve roots, not just the median nerve. Question 26. Topic. EEG encephalopathy. A 72-year-old man with sepsis and altered mental status undergoes EEG, which shows generalized slowing without epileptiform discharges. What is the most likely explanation for the EEG findings? A. Toxic metabolic encephalopathy. B. Absence epilepsy. C. Status epilepticus. D. Focal cortical stroke. Answer A. Toxic metabolic encephalopathy. Explanation: generalized slowing on EEG is a hallmark of toxic metabolic encephalopathy, which can result from sepsis, organ failure, or metabolic disturbances. Absence epilepsy B. Presence with 3AC spike and wave, not just slowing. Status epilepticus C. would show continuous epileptiform discharges. Focal cortical stroke D. produces focal EEG changes, not generalized slowing. Question 27. Topic. Mgen myopathy. A 35-year-old man with progressive proximal muscle weakness has EMG findings of small, short duration polyphasic motor unit potentials MUPS. What is the most likely diagnosis? A. Myopathy. B. Motor neuron disease. C. Neuropathy. D. Myasthenia gravis. Answer A. Myopathy. Explanation: myopathies cause small, short-duration polyphasic MUPS, reflecting loss of muscle fibers rather than nerve pathology. MND, B, and neuropathies C show large, long-duration motor units due to denervation reinnervation. Question 28. Topic. Higgin-Creutzfeldt-Jakob disease. A 62-year-old man presents with rapidly progressive dementia myoclonus and ataxia over the past 2 months. MRI reveals cortical ribboning and hyperintensities in the basal ganglia. Each shows periodic sharp wave compulsive occurring every 1-2 seconds. What is the most likely diagnosis? A. Creutzfeldt-Jakob disease, CJD. B. Alzheimer's disease. C. Lewy body dementia. D. Autoimmune encephalitis. Answer A. Creutzfeldt-Jakob disease, CJD. Explanation EJD. A prion disease causing rapid cognitive decline, myoclonus, and ataxia. Each shows periodic sharp wave compulsive which are highly characteristic of EJD. RI findings in EJD include cortical ribboning and basal ganglia hyperintensities. Alzheimer's disease. B. Progresses slowly and does not AOEG. Lewy body dementia. C. Presence with visual hallucinations, REM sleep behavior disorder, and fluctuating cognition or autoimmune encephalitis. D. Can show EEG slow but not typical. Question 29. Topic: NCS in Guillain-Barré syndrome. 45-year-old man presents with rapidly progressive ascending weakness and aphalexia after recent upper respiratory infection. Nerve conduction studies NCS show prolonged distal latencies, slowed conduction velocity, and conduction block. What is the most likely diagnosis? A. Guillain-Barré syndrome, GBS. B. Chronic inflammatory demyelinating polyneuropathy, C. Myasthenia gravis, NG. D. Multiple sclerosis, MS. Answer A. Guillain-Barré syndrome, GBS. Explanation: GBS is an acute autoimmune demyelinating polyneuropathy, often post-infectious. NCS findings in GBS: prolonged distal latencies, impaired conduction, slowed conduction velocity, demyelination, conduction block, impaired signal transmission, SID. B is chronic version of GBS, 8 weeks. MGC affects neuromuscular junction transmission, not NCS parameters. MSD is central nervous system disorder, not peripheral nerve disorder. Question 30. Topic: MG myasthenia gravis. A 29-year-old woman presents with fatigable weakness, ptosis, and diplopia that worsens with activity. Repetitive nerve stimulation RNS shows a decremental response at 3-HT stimulation. What is the most likely diagnosis? A. Myasthenia gravis. B. Lambert-Eaton myasthenic syndrome, LEMS. C. Amyotrophic lateral sclerosis, ALS. D. polymyositis. Answer A. Myasthenia gravis. Explanation: MG is an autoimmune neuromuscular junction disorder caused by antibodies against acetylcholine receptors. ASHA RNS-NG shows a decremental response due to failure of neuromuscular transmission. LEMS. B shows an incremental response, increased CMAP amplitude with high-frequency stimulation. ALS. C causes denervation, not neuromuscular transmission failure. Polymyositis. D is a muscle disease, not a neuromuscular junction disorder.